First thing I would say is ice. Ice on that lower back, 110%. There's two areas that we can ice. We can ice the lower back where we kind of top of the hips, and we can also ice the glutes. The reason why we would put ice over the glutes is because the sciatic nerve itself can run underneath the muscle, and it's not that deep either. And a lot of people then complain about glute pain. So that can be quite a satisfying area to put ice on. And the whole reason why we want to use ice is to get control of the inflammation. The majority of the pain, the tenderness, the lack of movement is caused by inflammation. It's those inflammatory little cells that kind of bring that redness, bring that heat, bring that apprehension to movement, and just make everything tight and sore and uncomfortable and extremely painful. So the ice will just help complement and calm it all down. Once it's calmed down, the nervous system starts to realize that there's not all these threatening signals coming from that area, because inflammation is healthy. It is healthy. It's put in the body for a particular reason, especially in our primitive days. You know, we needed inflammation to heal, and we still need it just as much now as we did back then. However, it was used as a disabling agent. It was meant to kind of stop you in your tracks, because movement is life. And if the inflammation didn't kick in and you would carry on moving, then you could have caused more damage back in the day. You know, that's just not the case now. We're not being hunted by dinosaurs and all that. So inflammation is healthy, but we also need to control the amount of inflammation, because otherwise it will lead to those behaviors where we don't move enough, where we become fearful of movement, or we start to catastrophize, thinking, oh my God, if I move, I'm going to make it a lot worse. Furthermore to that, then, working on the flip side of it, I would advise patients to also use heat. Heat, like a hot water bottle, hot shower, hot bath. Particularly with the hot water bottle, I normally say to place it on their stomachs. And quite a few patients get a little bit confused about this, but there's two muscles that live in our stomach, and they're lower back muscles, but they come through the pelvis and they attach to the front of our hips. And these two muscles are called the iliopsoas muscles, and they are very strong muscles, okay? And they flex our hips, so they can pull your knee towards your chest or your chest towards the floor. Okay, so if you see someone, or someone has had sciatica before and they've had really bad lower back pain or really bad episode of it, kind of hunched over, that's the iliopsoas muscles contracting. They're shortening to protect you from posturing up too much and adding compression into the disc that can cause the sciatica symptoms. Okay, so the whole point of the heat is to relax those structures, and then hopefully people then can kind of elevate back up. They can straighten up their posture, and they don't feel as if they're getting pulled towards the earth as much as they were originally. So it's kind of a double whammy effect. Ice at the back for the inflammation, heat at the front to relax those psoas muscles, because they're kind of like guy ropes of a tent, you know, and they will pull you forward, and they shorten tremendously. And they probably, I see it all the time in clinic, you know. So as soon as we kind of released those with self-management, you can, you know, release those psoas muscles, and then you get the ice on the back to control the inflammation. That's when patients should start to notice a considerable difference in their symptoms.